So joining us today is Ray Ribble, all the way back from episode, what was it, 14?
Yeah, I know.
Oh my
Back
gosh.
in the day.
Yeah, OG.
Oh, we can't hear them.
I know.
Yeah, and so this is what episode is this, Donna? 314? No, I mean, I think we're
329.
329. Good grief. Wow. So
That's a long
I have
time.
been listening since then.
yeah, so we finally couldn't keep him away any longer. Had to bring him back.
Alive.
Yeah. So but Ray is with SPHER, and are you CEO of SPHER? Is that right?
I am. Thank you.
Okay. So we're going to let Ray talk to us a little bit about what SPHER does. And back when we first talked to him, we're going to kind of go down the same path, which is his company is phenomenal at giving you the ability to audit your EHR logs. And so, the question today, our podcast is about, do you audit your EHR logs? And so before you just say no and turn it off, we're going to talk a little bit about some things that are happening in the news recently that being able to edit your EHR logs would have kept these people from a very expensive mistake. And Ray's going to share with us some things that he's been doing for some clients and why SPHER is so instrumental in meeting this HIPAA requirement. But Ray, tell everybody a little bit about yourself and SPHER.
Yeah. Well, thanks for having me on again. And God, I've been waiting. I got old while that happened, but I'm still here. I went out a mic and everything.
Yeah.
Go ahead, Don.
No, there was a listener question. Otherwise, we would never gotten around to it.
Thank our listeners. We always want to thank our listeners. Hello. Good morning from Los Angeles. So, to David, to answer your question, we're in the compliance analytics business, and that includes within SPHER's model is the ability to monitor the activity of our user base. So SPHER is a cloud-based solution. We don't install anything in our customer's office. We work very closely with manufacturers of EHRs, EMRs, oncology systems, practice management systems, so on and so forth. All of these clinical applications that the covered entities are using that have embedded PHI in them. And under HIPAA and a number of other regulatory groups out there, they have a responsibility for knowing who's looking at that data at any given time and protecting that data on behalf of the patient, on behalf of the organization, on behalf of the physicians within that organization that possibly own that organization. And as America has changed in terms of these consumer privacy laws that have come into place in many of the states now, there's additional complexity in terms of the ability to know what's going on. So SPHER is that type of a solution. We're monitoring the users who you've granted access to those applications and telling you what their user habits look like in terms of behavioral mapping. And we give you a daily report that tells you what's happening on a user by user basis in terms of any abnormalities. So we're using artificial intelligence and machine learning, which is the technology. Most people are really interested in technology. What they want to know, what does it do for me, not how does it do it? And in this instance, the technology is secondary. It's the solution we provide. We provide a front-end browser-based dashboard that allows them to see what's going on within their organization across multiple platforms on a daily basis. So that if there's an event, if there's some significant event alert in our world that occurs, they can click on that, drill down on that, and determine whether or not that activity is appropriate or inappropriate for that person, for that unit, for that business. So SPHER is, again, a compliance analytics tool. It is a monitoring tool. It's a user activity tool. And it has a lot of features, and it just allows large organizations to meet their requirements and a very small private practice to also meet their requirements, because everybody has to adhere to HIPAA and all the rules around that.
Right.
Long answer.
So from a high level, it's addressing that insider threat, which is kind of so difficult to catch.
It is. I mean, if we go back, and I've heard you guys in previous episodes talk about the Ponemon report, and Ponemon every year highlights insider activity as being the number one concern. Somewhere between 64 and 72% on a year-by-year basis of all activity that's malfeasance is from inside the organization. Nobody wants to think that SPHER is that tool that can identify that. we're not limited to just the insider threat, but we have a very good capability of identifying one of your credentialed users. Maybe a consultant that you brought into the organization, could be an employee, could be an ex-employee that you forgot to terminate properly, and they have the ability to get in, but you have the ability to see what they're doing and if any activity has occurred within that environment that might be leading to a major breach for your organization.
Well, and also you got to remember, credential theft is a huge business for criminals. So if they can get the credentials and use the credentials, you'll notice if they're doing things outside their normal job roles.
Absolutely. Absolutely.
So it's not just a malicious insider that is misusing, they're abusing their privileges if they are doing it intently, but it's also so many people are having their credentials stolen these days. Those happen as well. So
if I could compliment what you're saying there, Donna. So if I'm the bad guy, and I remember in Georgia, you had an instance like this where the organization was able to do ransomware using phishing to get into the organization and steal somebody's spreadsheet that had all of the login credentials for the entire organization. They then turned around and logged into the EHR and stole all of the data. They made it easy for them, right? So
exactly,
the breach took place at the network level. That allowed them to then get to the healthcare systems level and steal the data they were really looking for. And they didn't know it until they got it, right? But once they were in, by the way, and this is my pitch to everybody, they used a recognizable user password and login. So their system had no reason to believe that anything abnormal was occurring. If they were running a system like SPHER, and they saw that somebody logged in at 2 in the morning when they never log in at 2 in the morning, that would have been an alert that could have created an activity on their side to investigate it and shut the system down, instead of learning 280 days later that all their data had been stolen.
Or when they get the notification that pay up, or we're going to tell everybody.
Yeah. And to your point as well, it's probably worth mentioning that if you hire a company, an MSP or an IT company, when we're providing monitoring and management and all these things, that keywords we like to use, we're not monitoring and managing access to EHR. We're not looking through EHR logs to grab this data. So, that's one of those things where you need to talk to your IT vendor. And if they're telling you we're monitoring your users, to what degree are you monitoring users? Because I might be able to monitor the users that are logging into the network, but I'm not monitoring the users that are logging into your EHR or EMR platform.
That's correct. Yeah. That's correct. I've yet to meet an MSP that has that capability. I've met many administrator of medium-sized and large-sized healthcare organizations, covered entities, that literally are using a clipboard and looking at 5 to 10 employees every Friday afternoon and using it as their metric of, yes, we're safe and we're compliant and nobody's doing anything out of the normal. But we're talking about an organization that has a database of 50,000 patients and a couple hundred employees, and they think that 5 or 10 is adequate. And I'm going to tell you, from my perspective, and Donna, you can back me up on this, that's probably not regular or appropriate.
Well, statistical analysis, it's going to tell you that you're just kind of scratching at it and, you're not getting anywhere. But it's like the ice pick to save the Titanic. It's not really helpful. But I will say that this all started because we had been talking about the difference between IT and monitoring programs, the SIMs and all of these kind of things, versus the monitoring of your applications and the access to your applications. Those are two different things. Right. And that's what we're trying to tell everybody. And we mentioned it then, and a listener sent in, great idea, but that is a lot of access. How am I ever going to be able to audit these logs? And if you're not using a tool, then you have to be doing it manually. And to do it manually, you're making an effort, which is what matters. But many organizations, they only look at VIP patients. In your example, it's 100. employees, and I'm going to pick randomly certain employees.
Sure.
But even in an office where there's 10 employees, everybody's too busy, and you assume, well, I know everybody and I see what they're doing. So I'm sure they're not doing anything wrong. And I can tell you, neither one work well. And I have seen statements. Sometimes I have to rethink how I can state things. Where did I see? Okay. So I have seen statements where employees have actually said in a larger organization, we'll say, that if you keep your mouth shut, you can do anything you want, and because they won't catch you. And if they catch you, they might catch one day of something that you did. So you can do anything you want. And this was an employee who had been recently let go because of their abuse of their privileges. And it turns out they had been doing it all along. And that's what she had told other employees. Keep your mouth shut and you can do whatever you want.
Right. Well, if there's no safety guard on the corner, then everybody can jaywalk and do whatever they want, whenever they want, with no impunity. I have a similar story on this side of the continent, where an organization approached us after the fact. They had an employee who'd been working for them for 12 years. And only when they brought in a new CPA firm did they realize that somehow they were missing, for the last 5 years, about $30,000 a year. And it was all from their cash transactions. And what they found out was this trusted employee was going in, and every afternoon when everybody went out for lunch, she would manually go into the system and change all of the cash transactions by 10% and take that for herself. Wow. She'd been doing it for years, and she was one of the most trusted employees in the organization. And when they had the discrepancies, they thought the girls might have just been doing a bad job in the front office of handling the money and the cash payments for co-pays and things like that. And you can't see me shaking my head, but no, unfortunately, they found out it was much more devious than that.
Yeah, it's almost like federal income tax.
Nice, Dave, nice. Yeah, but there's so many stories that we hear when we go in. A lot of times, unfortunately, we get a call from organizations after they've had the breach, and now they want to kind of sort things up. I think the emphasis I'd like to share with you and with everybody who's listening is do something before it happens. Know what's going on in your organization. That's how I got in this business. I shared this with you in episode 14. I'll do it again. I was one of the organizations that helped over 2,000 organizations here on the West Coast go through meaningful use in the high-tech program. And of 2,000 plus organizations, not one company, when they checked the box, implemented any privacy and security policies and procedures for monitoring user activity. That's how I got into the SPHER business. That was my driver. It was like, wow, this is a big problem. It potentially could be crippling to my customers. That was these 2,000 organizations. What can I do to help them? Is there a technology? Think about Staples. Staples, they advertise the easy button. I wanted to create an application that was really easy to use, low cost, that covered them from a privacy and security perspective in terms of their ability to see what my employees are doing or any third party that I grant access to my data. I just want to know that. I want to capture that data and have it in a repository that today, tomorrow, or 5 years from today, if I get accused of some malfeasance by a third party, I can pull that up and say, no, here's my documentation. On that day, I looked at all the users, I took these steps, I investigated this, and I found that there was or was not any malfeasance involved in this case. And I can prove that. And that's the system we built with SPHER. That's how we brought SPHER to market. That was my vision. It started out just helping my clients here in LA and Southern California, and it grew to a product that now is sold across the US.
Well, and that's another point of how you and I started working together is you started in the small end of the industry and grew to, deal with the hospitals and the larger entities. And that means that you do understand the private practice market. You do understand the difference of what they're up against and what they have to deal with than a big health system or a hospital, of any size. There's a whole different world.
If I were on a TV show, I'd be taking hats and putting them on and off right now. Visual of an office administrator for anywhere from 1 to 100 doctors.
Right.
And that individual's tasks that they have in privacy and security and breach notification and all of these tasks, policies and procedures that need to be constantly updated, what that means to them and how big of an impact that is, the security risk assessment on an annual basis, and getting it right, and then finding a good MSP who can step in and help them to fix the problems. I get all of that. That's why I built SPHER, was to be I always tell people, we're not the end all end-to-end solution for privacy and security. I never meant for us to be. What I wanted to be is a very good component as part of their cybersecurity framework for their organization. And I think I accomplished that.
Well, you're a good component for us, so we appreciate that. But when we go in and we're trying to help people figure these things out, that's where, the listener said, this is a lot of data.
Yeah.
And one of the things that you guys are always able to say is you look at every access, not just the random ones. And so some stuff in the news that David mentioned earlier, a couple of cases in the news. I mean, I just like last week set this date with you to record this interview, and then like the next day I see one of these, and then before I even get a chance to do, I see another one, so these are happening all the time. These are the hard ones to get. These aren't the big splashy data breaches.
These are the ones that got reported.
Yeah These are just the ones that gotten reported. And I know David knows about how often in a small office we just pretend we didn't see that.
Yeah.
I mean, isn't that kind of the way you look at it, David? Unless your systems are popping up and telling them, and then they're like, well, we want to turn that off.
Yeah. I mean, I've had a doctor of a practice that had a data breach ransomware attack and said, we just want to move on.
Yeah.
Well, how are you going to address this? You're going to notify and all this other, we just want to move on. It's okay.
Yeah.
Alrighty then. Yeah. So, but there's two stories. One is Premier Patient Healthcare.
Yes.
On April 30th, a technology vendor of theirs, Wiseman Innovations, discovered evidence indicating a former executive of Premier and its contracted technology vendor obtained and accessed a file containing sensitive health information in July 2020 after the termination of their employment. Yeah. Not good. We often talk about the importance of onboarding and termination, although I got to adjust to the one I heard, arrivals and departures checklist. But there is a key element right there that we know. So they're finding out April 30th, and the technology vendor is the one that found out. Don't know how, but it sounds like they had a person involved. So they found out not by seeing something in a log. And it happened in July. So how long would it have taken that to kick out on SPHER the way you connected in for reviewing all of those things?
Everything within less than 24 hours.
Everything. As long as this data is coming to you, it's going to figure it out.
We examine 100% of the audit logs from the daily dump that comes from whatever system we're targeting. In this case, let's say an EMR system. We're pulling in that audit log every evening from the last 24 hours. We don't do real time because real time would be very obsessive for the organizations. And with the reporting statutes that are in place, if they look at it daily, that's good enough, right? So they get the last 24 hours. So if that event had taken place at 11 o'clock at night, at 8 o'clock in the morning, they'd have a report that it happened. So that's way less than 24 hours. But if it happened at 8 o'clock in the morning the day before, 8 o'clock today, they'd have a report, and they can immediately start to take corrective action. They'll know what patients, what actor, what system, what time, what location, what office. They'll have all that information at their fingertips inside of the SPHER dashboard. They can start making calls and bring people in, pull out an employee, call a vendor, whatever they need to do, call the police, call the FBI, whatever they need to do from a breach notification perspective if they identify some malfeasance.
Call Donna.
Some of our clients have done that.
Yeah, they have.
Been there, done that. Yeah. So, I mean, I hate to sound like I'm selling. I don't want to do that. But yes, Donna, within 24 hours, we put them in a position to stop that event from going any further. I want to quote Simon again, because I love something he talked about, which I thought was amazing. He said, if you can identify a breach within the first 200 days, you can save yourself $2 million in fees. Right?
Wow.
And I thought, 200 days, I do it in 24 hours. So what's that worth?
Well, yeah, you give them the alert. They do have to look at it. There is that.
They have to look at it. But to the credit of our client base, because we monitor that they're looking at it. We don't want them to be 3, 4, 5 days out not looking at something. So we will let them know. We'll give them a tickle.
Tickle. You mentioned moonshiners before we started recording. Then you get, okay, go ahead.
Call them politely and say, hey, have you been looking at your alerts? How's that? And yeah, oh, we've been really busy. Okay, get in there. If they use SPHER the correct way every day, they would probably spend between 8 and 10 minutes a day reviewing the alerts, if they have any. And the more you use SPHER, because it is a machine learning based system, the more you use the product, the less you will use the product, because it becomes smarter. It develops a more complex model of each of your employees and how they work and what they do. You don't have to go in and reprogram it. There's no programming on your part. So yeah, we're able to catch very interesting things. It's very easy to implement. It's very easy to use. You don't have to be a computer science person. You just need to know how to read a very simple dashboard, like a spreadsheet even, and just make a determination. We take the codification that's in an audit log that's hard to understand, and we turn it back into English again. So that you can just,
yeah, that's one of the things that I really loved about the meaningful use requirements was you have to generate the log.
Yeah.
That was it.
If you can, right?
Yeah,
right?
That's it. You don't have to read it. You don't have to know what's in it or anything else about it. It just has to exist.
Can I hit on something there? And I'm not picking on any of the EMR, EHR companies out there as an example. Their job is to generate the audit log. It's your job to review it.
Exactly.
And so people will say, well, my EMR, my EHR company, they already do that. And we'll always say, hey, make sure you understand what they told you when they sold you the product. They generate an audit log. They don't review the audit log. That's still your responsibility. That's where the line in the sand is drawn. So we're automating that review process for you. And again, we make it inexpensive. That was my goal from day one, to keep it very inexpensive. And Donna, you know, we do a great job for that. And so we want to keep it easy. We know that your core business is successful outcomes of patients who come to visit you. It's not being the best at privacy and security. We'll be the best at privacy and security so that you can do what you do really well. And that's the marriage between ourselves and the organizations we work with. But 8-10 minutes a day, if you just use SPHER. Last year, we captured over 1,300 violations in our system for our clients.
Wow.
Right?
That's a pretty solid clip.
Now, I'll tell you what the number one was. Last year, we were in the middle of something called the pandemic, right?
Oh, yeah. Yeah.
And
it's not like it's gone.
No, it's not like it's gone, sadly. Don't forget to get your booster.
There you
go. That was my official plug. You guys are in Georgia.
I have mine.
At. So, what was the number one thing that we caught people doing during the pandemic? Snooping was number one. It took over number one slot.
Well, prior to that, what was the number one thing?
Time of access. We would catch people logging in at times that were not consistent with their user model, that were doing things that they shouldn't be doing. In some instances, it was they were doing work that should have been done during the day, or they got an emergency call. There's very legitimate reasons why you're logging in the middle of the night. There's an emergency, the doctor calls, you going to pull out a record, get that to him because he's on his way to a hospital. That would be an example of a time of access that's out of the norm. Great, you can explain that. You understand why that happened. It's when Ray logged in at 2 a.m. and was looking at 500 medical records for our VIPs that doesn't fit in well with his model or what we do as a business. That's the one we want to know about. And that was our number one priority to that. But snooping has taken over and has continued to be, on a month-to-month basis, our number one trigger for organizations that are using the product. And they know that the SPHER is monitoring them.
But is that, do we, you know, sometimes it's just like you look at people like, did you not hear what you said when you said it?
Sometimes it's not just the technology that has artificial intelligence. Sometimes the employees have artificial intelligence.
It's like that. But again, it goes back to this long-standing belief that you're not going to get caught.
Yeah.
You know, that, and a lot of that, you know, the original versions of tools, you know, they went into the hospitals, the bigger names, and you had to write all these rules, and there was no way small entities could deal with just, I mean, you hire a person just to maintain the rules and deal with the things that it kicks out, and then you have to change the rules. So, I mean, that's the way this all started, and people still got away with things.
Well, you were talking about what if statements earlier in our conversation.
Yeah.
Right. So the what if scenario was another one of those triggers that took me down the path of using artificial intelligence to do this, because there's too many what if scenarios to consider and hard code into an application.
Exactly.
Personally, I wanted to follow Visa, MasterCard, Discovery, and the way they look at traffic, the way they look at a user in terms of a pattern. And that pattern will be more indicative of something proper or improper. And really, I mean, is 8 to 10 minutes a day really a big imposition in terms of you keeping your organization safe? I think no, but I'm buying.
It's called bathroom reading.
Yeah. that would be longer, I think. You know, Facebook, Instagram, they need some time. I think it's pretty short period of time for them to get something that's really important. And if I'm arguing the cost, it's not ROI. I never talk about ROI, but it's the cost of not doing it is really what comes in.
Right.
We were. Go ahead.
Well, it's just so much of what you do in the privacy and security world is to be preventative.
Yeah.
So your ROI is only recognized if you don't do it.
Well, I was going to go down that path. So
you
then turn around and go to your insurance company and say, hey, by the way, we've implemented this SPHER solution. So we're now looking at 100% of all of our activity. What can we do with our policy to lower our risk coefficient and maybe pay less on an annual basis, because data loss prevention is now part of our core?
Well, as we've been told by our expert we bring on cybersecurity insurance, it won't be that you pay less, it's just that you won't pay more.
maybe not paying more these days is okay, right?
Yeah. If I'm just paying like similar to what I was paying last year, I'm good.
Be happy. Yeah. There's something to that though, right?
Yeah. I've got to show that I'm doing these things, and it falls under recognized security practices and you know, the things that we're doing with 405D and all of that. But this is a key element, and we talk about it from the technology side. And most IT vendors, I mean, you know, there's the different levels. And so I think, well, David, now I don't know which ones you do, but when you think about the layers of logs that you got to deal with, right? So you've got just logging into computers and the network and whatnot. So that falls under your IT people. Then you've got, well, David, take me through, and then you get to SIM and all of that, but you still never touched your EHR.
Most of what we're looking at on the IT side is we're looking at access to systems or access to the network. We're not looking at individual software platforms or, and things like that.
Applications.
That's
Yeah.
where the line is drawn. So David, I also am very familiar with what you do, having done that in my life for a long time. So I appreciate that. If I can characterize it, David's group is looking at that big pipe we call the network. And it wants to see where the water's branching off, right? Now, once the water goes into that branch, we're not looking at what's happening inside the branch. We just know water went there, right?
Yeah.
Mhm.
Okay. SPHER is looking at what happened after they came in. What did they do while they were on the inside? So whether it's your employee or somebody who's impersonating your employee because they stole your credentials, we want to know what did they did, and what they did that cause any harm or potential damage to our organization? If so, I want to be in a position to very quickly rectify that, report that, and not stop it from happening again. Then I can go back to David and say, hey, look, this happened. What can we do on the network side to prevent that again as well? Because then we can go back and take corrective actions with the network vis-a-vis what we learned from SPHER identifying something within the application. And they do marry up really well at that level. And you need both parts to be truly compliant in terms of security.
Yeah, that's like we make sure that the people coming into your house are who you want to come in. But we don't look at whether or not they should go into the bedroom or the bathroom. SPHER's looking at, these people shouldn't have access to your bedroom.
Great analogy. Yeah. Hey, where's your bathroom? Oh, it's down the hall to the left. Oh, look at that. The door to the master bedroom's open too. So I'll take a couple extra minutes to go that other way. And nobody's looking at me, so I can do that, right? That's the analogy. That's what's going on here. And we want to know if they do that. That's all. We want to know if they're doing that. And then we want to determine what did they look at while they were there, and was any of that potentially damaging to them?
They was in your drawers.
I'm not going to touch that one.
They went in your drawers and found your breeches.
Which led to breaches.
Yeah. Then you ended up with some breeches that you didn't want. Stay out of my breeches. Oh, anyway, but I think in a lot of ways, the technology people forget about the application part. The clients forget about the application part because, they're just busy. And one of the things that we really wanted to do is to make sure that people understand these things are there, but you need to be at a minimum periodically doing random evaluations.
Yes.
And by random, I mean truly random, like, and you pick patients. A lot of people will pick a patient and then follow the patient through. Others will pick an employee and see what they did that day.
Yeah.
I would say, particularly if you're in a small town environment where everybody knows everybody, you're better off picking a patient and following it all the way through. Because one of the things that I really found interesting that you told me you do in SPHER is it can see, like, this is the normal way a patient moves through the office. And if all of a sudden it shoots down here, goes to during the normal process, but it shoots to a different path than the normal path, then you recognize that. And those are the kinds of things you have to look for.
Those are the anomalies in the usage pattern that we're looking for and we bring to your attention. And we do that both in a written form and a graphical form. So we give them a graph as well, so if they want to have more of a quick, intuitive view into what the problem might be, and they're trying to determine, is this really a bad thing? Did something bad happen here? They can look at that really fast and say, oh, okay, so here's what happened. They logged in at 2 a.m. They normally never log in at 2 a.m. It's a big red dot there. I can go investigate that now and look at what they were doing. If it's within their normal pattern, then are they accessing data that they don't normally access? And I want to know about that as well. You mentioned VIPs. This is a big issue with VIPs. The one that always comes to mind was the Justice Smollett case in Chicago, where, if you can remember, that was a few years ago now. We won't worry about what he did and everything, but when he went in there, he was a VIP at Northwestern Medical Center. 26 employees were fired because they went in and looked at his record after he was there. They were looking at photos that were taken.
Yeah.
Who knows what their motivation was, but they did it and they knew they weren't supposed to do it. It wasn't identified for between 3 and 6 weeks later that had happened. Had they had a system like SPHER installed, one, there would have been a deterrent. Everybody would know, if I do this, I'm going to get caught. Two, if I do this, tomorrow morning, HR is going to be standing at my cubicle saying, we need to have a talk.
Yeah.
Right? They probably would not have fired 26 people, maybe 6, because the other 20 would have said, oh, yeah, I better not do that. So it does have an impact on an organization. All of our compliance officers, all of our administrators choose to tell their employees that SPHER is being implemented and they are being monitored. And it does change habits. So one of our big clients in Georgia went live with our system a few years ago, and the first month had 1,800 events. Now you would say, oh, hold on, Ray, that's not helping. That's hurting us. That's ridiculous, right? The majority of them were all snooping. I guess in Georgia, a lot of people like to know what other people in Georgia are doing.
They get up in your business in the South.
I heard about that. Now, I remember the CIO telling me, this is a problem, Ray. You've made my life miserable because now I have to follow these up. To her credit, she did. Education became a big issue. Right? And everybody got lectured appropriately. Within 3 months, they were down to less than 10 and then 0.
Right.
Okay. It changed the culture. People realized I can't do this anymore. Bingo, it was done. So
but prior to that, they were told not to do it, but and they'll tell you all day long, you told me not to do it.
Think about how long that's been going on.
Yeah.
You know,
which is bringing up the second story in the news.
Yes.
This is from New Jersey University Hospital. They said on August 24th, we learned August 24th, 2021.
Yeah.
This is key in a minute. We learned that a now former, i.e. just got fired, I always love that, have access and provided patient information to unauthorized individuals between January 1st, 2016 and December 31st, 2017, 2 years. This former employee had been authorized access. They had authorized access to patient information to perform the essential functions of their job and exceeded that. So they abused their privileges, and a criminal investigation is ongoing. The individual, now here you go. The individual had access to some patients' names, addresses, dates of birth, social security number, health insurance information, medical record numbers, and clinical information related to the care you may have received, but only if you were in the emergency department. 9,329 patients.
Yeah. Major breach, isn't it?
And took 4 years to find it.
Yeah, I was just going to say that. Yeah.
It went on for 2 years, and after it ended, then they find it.
And it was a third party. It was a third party probably doing something else in terms of investigation that uncovered it.
Yeah.
Right.
Well, yeah. And from the looks of this, if you're in the ED department and you're pulling information and giving it to an unauthorized third party, we know who we're probably talking about.
Yeah.
Right. We don't have to go down that, but it, and the thing is
great.
The thing is that, employees are lured into this stuff. It's, I heard and I mentioned this before because I remember just being stunned. I think everybody on the call was. I was listening to a panel of speakers, and it was a health system in Northern California. The CISO was talking and said that they were fortunate that during the pandemic, the big crisis moment, that they didn't, they had to keep things up and running. They were a hospital health system. They didn't furlough anybody or anything like that, but their affiliated offices, the physicians' offices, did. And they had an employee at one of those offices reports and like brings it. And thankfully it was someone that was honest, came in, and they had been offered by a malicious individual. Obviously they had been offered like $25,000 to sell their access to get into the health systems. And it's so in this case and in other cases, I mean, the Farrah Fawcett case, which I'm sure, you know, Southern California, it turned out that all of her stuff was being leaked by someone who had cancer themselves and needed the money to pay for treatment.
Yeah, we have so many instances. I'm reminded of a client in the state of Michigan, in Detroit, a large hospital that found out it was a member of their privacy and security team. The bad guys were targeting hospital employees in the local bars around the hospital. So if you walked up and said, "Hi, how you doing? I'm a lawyer," they didn't want to talk to you. "Hi, how you doing? I work for a Ford Motor Car Company. I don't want to talk to you." "Hi, I work for XYZ Hospital. Hey, how you doing?" Right?
Yeah.
They
Let's
were
chit chat.
and they were paying $1,000 minimum for each set of records, and there was a volume of records they were looking for. The only reason that it was caught was because the Detroit police were running a sting on a drug operation, and that drug operation was also running the operation with the hospital getting the records. And the police officer who walked in saw that his copy of his medical record was on top of the papers in the room when they went in to do the bust on the drugs. And that led to them discovering this secondary thing.
That's
and
a bad day.
And the thing was is that the information was in the last couple of days. And so that cop said, "Hold on a second, that's data I just gave them. This is like real time." And so they contacted the CISO of that hospital, who then said, "Wow, the only way that could have happened were these scenarios." They looked into it and actually found, and it turns out that the person who was doing it, the police, as they were getting ready to do the sting, they had observed this woman leaving the house. She wasn't a suspect, so they let her leave, and then they went in the raid after. So she had just walked away. She was the employee from the hospital who had been stealing the medical records.
Wow.
Okay.
See,
I left a lot out there for obvious reasons.
Right.
I hope I didn't make that sound too discombobulated, but a very real thing. It really happened. We have an incident here I can share with you with a big client of ours who had an employee who had left 3 years prior. That employee, and David, this goes back to what you and I were talking about just now about the network versus the application. This employee still had all her logins and passwords, and for whatever reason, we'll never know, decided to attempt logins into their system after 3 years after being terminated, trying to get in, pounding away at it. Not one attempt, not two attempts, multiple attempts, trying to get into applications, trying to get into the network, using the portal, using the patient portal, right? Different things that she knew from her experience when she was working for the organization, and basically pound, trying to get in. SPHER identified all of these attempts as unsuccessful login attempts. When they look at the IP address, they were able to trace it back. They found that associated with an organization with a name, and they said, "Oh my God, this is an ex-employee who is trying to get in." And Donna, I think I shared this with you before. They had failed to properly terminate network privileges for this employee, and they've been sitting there dormant for 3 years. So, you know, bad IT, but luckily SPHER was in place to identify the attempts that got them moving in action. They were able to take corrective actions and get that fixed. There was no legality there because she didn't break in, she didn't get in, she knocked on the door illegally. I don't think that's fine, but we know she probably wasn't looking to leave a message and say, "Hi everybody, how you doing? I haven't seen you in a while." Probably something else in mind, especially from the state of Florida.
Yeah, then we go down a real
eye roll. You know, so these things happen a lot, and you know, I'm proud of the fact that our technology captures them, brings it to the attention of somebody who's responsible that can take corrective actions and prevent a major breach from happening. We don't want any of those stories to be about them, right?
Right. Yeah. And I know that you've had cases we've talked about before where, and this is an ongoing problem. I deal with this from time to time, that employees are leaving and they're wanting to take a patient list with them,
Yes. Yes.
particularly if they're clinicians and they're going to take my patients with me.
I'm going from company A to company B, and I'm moving over, and somebody over there might say, "Hey, do you know any of the patients who might be interested in coming over here? Oh, I can send you a list. In fact, let me email it to you."
Yeah.
So
Oh, those are my favorite.
if they-
Emailing it to their personal account.
yes, let me email you a list of some of our patients that you guys might be interested in your practice. And basically, there's no monitoring solution in there. Maybe on the network, David, the send might have picked up a large packet that was going out, but God forbid, if you didn't have that, you didn't know. And I know of a case in Colorado where it was by sheer luck that the administrator identified the breach only because she took the laptop from the employee when she terminated her. The next day, she went in office, opened up the laptop, getting ready to reset it, and she saw that the last thing she had sent was an email to a previous employee who is now at the organization saying, "Are these the customer names you were looking for?" That was the title of the email, and 4,000 patient records attached. And that is, you can find that on data breaches, and it's a well-known case. But that happens. That happens sadly more often than not. Well, I mean, we could spend a whole hour talking about case studies of things that have happened.
Just stories.
Your point, I think your point today is, how can we make this easy so it doesn't happen to us? Right.
Well, the point is you need to do it.
Yeah.
And you have to do it one way, but the bare minimum is you have to do it manually.
Yeah.
But there are a lot of reasons that you want to invest in a tool to assist you in this process, because of the things that the tool finds that a random one is likely never going to find. And most of the ones that do random evaluations, it really ends up being that they use the logs as a reactive, not a proactive solution.
It's extremely hard for any individual to read those audit logs and make heads or tails out of them, and then determine from that small sample set if malfeasance really is occurring with that individual or that patient. That's where we come in. That's where that tool that you're talking about would come in and basically take a very complex, and let's we haven't talked about it, but how many records does a small practice generate in a day that need to be reviewed?
Oh,
right.
Well, I mean, you look at the stats that say in a hospital, even employees are going in and out of records every 8 seconds. Well, on a full day in a practice, it's not a lot different.
No. Our small single provider practices generate anywhere from 5,000 to 10,000 records a day. Just as an example, we have a major hospital that's using our system that's measured in the millions.
Yeah,
that's your point that you're making. We review both. Within 24 hours, both of those organizations have a readout and have a report available to them of what happened in that time period to keep them.
So I have this report, and I forgot to tell you about it, but it has this thing when it talks about insiders. ISACA, ISACA, published this report, A Holistic Approach to Mitigating Harm from Insider Threats. But they have a whole section on mice, what turns a good insider to a bad one. And they talk about, and I want to bring this up just for people to think through their staff. You're going to have mistakes, you're going to have all of this other stuff, but it's the malicious ones and the ones that really create the problems that we're trying to catch. So they use this example, and they were like, okay, human intelligence operatives, I love this, spies, they have an acronym called MICE that they use to identify people they can recruit to spy against their own countries. And we just had the story of the dude putting stuff in a sandwich. So nuclear sub threats inside a sandwich. Hopefully it didn't have a lot of condiments. So, but
light on the muscle.
So what it points out is that they see this mice is that it identifies people that are susceptible, and they will unilaterally choose to harm their enterprise and become a malicious insider for those same reasons. So here's what mice is: money. Okay, we all know, but we don't need to, they'll rationalize their way into money one way or another. Ideology, the political, their ethical, their whatever. I also know it as a disgruntled employee falls under that to me. And we hear a lot of that. Coercion, some sort of blackmail. They're in a compromised situation. And then ego. I've been treated unfairly, so I'm going to do this. I've been slighted, so I'm going to do this, to get back at people. So mice. Now, if you think about people in your organization, regardless of the size, do you know anybody that has money problems? Do you know anybody that complains about their job a lot? Do you know anybody that is prone to doing stupid things that they don't want out in public? Or do you know anybody that always feels like they're not getting enough respect? How many companies? David's like, yeah, I know all of them.
Yeah, that's me.
David is mice. That's why he owns his own business.
You are human. So, you are a human and operative. I call you a hoe.
That's like the human operated ransomware we like to talk about.
Yeah.
HOR. Anyway, but the point being, if you look at your office and you're thinking, I don't have to worry about this right away, you're probably in trouble. Number one. Number two, you need to be aware that mice are everywhere. I just love that whole thing. I mean, you don't know what's happening in other people's lives. You don't know.
Can I just interject and say, at what point they could be a great employee, something that you don't know about, and they go from not being a mouse to becoming nice, right?
Yeah, exactly. And you don't know it, particularly on the coercion and the money. Those two become a big thing. I've heard some very horrific stories about people that end up in relationships that turn out to involve domestic abuse. And if you don't bring home stuff that I can sell to make money, you're going to pay for it one way or another. So these things all happen. And the conclusion of this report that goes through a lot of other things, it's got some great stuff in it. We'll probably come back to it at some point, but it says, through anticipation of user initiated losses, they can be proactively mitigated. The application of human security engineering, which our last episode, we just talked about, you have to listen to the story of where we had our own company's social engineering attack. It went over really well with the team, but it's great. You will later tell you what Carla had to say in a choice moment. But the application of human security engineering principles reduces the likelihood of users being in a position to initiate the loss. So proactively anticipating the inevitability that other countermeasures will fail makes it possible to mitigate insider threats in whatever form they may take. So it's basically saying right there, this is inevitable.
Right.
So what are you going to do to make sure that you do these things? And the user's question was, how do I handle this? Because it is overwhelming. The best way to handle it is with a tool like SPHER, and that's why we brought Ray in.
Thank you for having me. And yeah, I think we align really well with that user's ask. How can I do this? I don't have the time in the day. I care about privacy and security. I care about my organization. but I can't possibly sit down and try to figure this out. And I get busy on Fridays sometimes, so I skip that task an occasional Friday of doing a manual review. Well, the good thing about SPHER is SPHER gets to work. It's a piece of technology that gets to work for you 24/7, 365. You don't have to worry about it. You don't have to give it a vacation. You don't have to give it a bonus. Give me one if you want. you don't have to give a holiday. It doesn't take a sick day. It's just there working for you, monitoring what's happening. And in the event that something abnormal is identified, it brings it to your attention. You can meet your compliance, your privacy, your security requirements on an ongoing basis. And Donna, you always say this, right? If it isn't documented, it didn't happen. Documents everything. So you now have a living record, which belongs to you, by the way. I want to make that clear too. Everything you do belongs to our users, not to us, right? So that you have access to that at any point in the future that you might need it.
So you can prove it.
So
you got to prove it.
Right. God knows.
Yeah. And one thing I just realized that we haven't really talked about, and a lot of people have an issue with this as well, is it doesn't matter to your application whether it's a cloud or a server or we don't care where it exists. We just get the logs.
And we don't care where the user was when they had access to it. Right. We just want to know, and it goes back again to the conversation with David as well, from the network into the application. We just want to know when they came in, what did they do? I don't care if they accessed it from home or from the office or on vacation. When they went in, did they do something that was inappropriate or appropriate? That's all we really want to know. Authorized or unauthorized access is really what we're talking about here.
So that I think that this issue is finally, I know when you first started, I was like, this is something that really needs to be done, but there are so many things that people are already not doing that, and now you can't not do this kind of stuff anymore.
The good news is what I've seen in trending since I got started in this is that now privacy and security is at least a top 5 conversation piece at the table of most organizations.
It's really a business risk and recognized as one now.
It is, and there's multiple buttons that are leading them to the same conclusion. We have to do something. But and you are right, they can do it manually, but I believe more and more organizations are coming to the conclusion that manual just isn't good enough. It's like,
well, and it's a key piece. It's a very good example of where technology can be used, and this is something that we talk about often, and it can quickly get David on a soapbox, that technology cannot be the solution to everything. That I don't have technology to make all of my problems go away, but this is a very good example of the value of a technological solution to a problem in a way that really does change the way you're able to run your business, because now I don't have to worry about it. As one of your clients told you, they sleep better at night.
Sleep better at night knowing that their 3 million records are being reviewed every day for any type of malfeasance against their business. So she says, I can worry about other things, but I don't have to worry about who's looking at my data.
Yeah, so I'm not going to go into what other things we have to worry about, but we all know what those are. So I appreciate you joining us. I know that, David's missed you. I get to talk to you. David never gets to, but then y'all had the whole moment over zombie response team earlier, which is a whole nother story.
I love that Jeep, David.
So as far as, pardon?
It's been 300 episodes. Let's get together sooner.
I know, right? But if somebody wants to talk to you, how do they talk to you?
Well, please take a look at our website, which is SPHERinc.com. I'll spell that SPHERinc.com. On there, there's a number of buttons they can click on and get a hold of me. If they want to reach me directly, Ray Ribble, Ray.Ribble at SPHERinc.com. Go to my LinkedIn page. I'm there as well, Raymond Ribble on LinkedIn. Any of those would allow you to get a hold of me.
Or you could reach out to us. We
Or you
know
can
him.
reach out- reach out to Pardon. You can reach out to David. Both of you guys, we've worked together in the past, and they can help you. By the way, most of our deals that we've done across the United States are done with partners. So our partners come to us, they bring us in. We work together with a lot of MSPs in the United States because, David, you pointed out at the beginning of the conversation, this is the one part that they don't do. So they'll come to us and say, hey, I have a really large group of healthcare organizations that we support from a data perspective, but we don't have the capability to monitor who's looking at that PHI. So is there a way for us to bring SPHER in and basically resell, so to speak, SPHER as a partner? And that's a big part of our go-to-market strategy. We've been very successful there. So if somebody here is an MSP and they're listening to this, feel free to reach out to us, and we're more than happy to have that conversation as well.
Yeah. If you're like me, you're like, I'm not touching anything with PHI.
Yeah. So, but thank you for having me today. It's great to be back on the show. I love the show. Send so many of my friends. I send friends from the UK, from Asia, to listen to you guys as well.
Awesome.
You know, it's really interesting. You were talking a moment ago, Donna, about what's going on out there. Right now, I'm monitoring what's happening in Asia, GDPR in Europe, but in Asia now they have something coming online called the Digital Agency, where they're trying to get, they call it PIPA, PIPA versus HIPAA. And the Japanese are very quickly trying to catch up with the US in terms of what they're doing in the healthcare industry, as an example. So yeah, we have a lot of work to do here in the US. We should be proud of what we've done so far. And if we can help somebody together with Cardin, together with David's organization, then we'd be really happy to do that.
Yep. Sweet.
Yeah. What? We're all, getting old and nerdy, but that doesn't mean we're not staying on the edge of technology.
When you go to open your Japanese branch, let me know. I'll go over there and help you set it up.
Be careful what you wish for.
I know, right?
Yeah, I'll take a hiatus.
Well, there you go. There you go.
Yeah, it's almost worth the flight cost just to get the ramen.
Hey, you got lucky because you went there just before the pandemic, didn't you?
Yeah. Yeah, I did.
Yeah, so that's great. Are we done recording at this point? I should ask. Just because I was going to say, they just reopened Japan. You had to quarantine for 14 days if you went over there.
Oh, yeah.
That's the tough part. You got lucky in your trip over there.
I did.
Yeah.
No, but we will wrap it up now, though. All right, folks, thanks for listening to our show today, and be sure to reach out to Ray and SPHER if you have a need for their services. And remember, for Donna, myself, and Ray, the HIPAA is not about compliance. It's about patient care.